Welcome to Learning and Teaching Systemic Therapy podcast, the official Society for the Teaching of Marriage and Family Therapy, STMFT in short, podcast. I'm your host, Dr. Sofia Georgiadou. I created STMFT and this podcast as an antidote to the isolation I experienced as an early career academic. I also created STMFT and this podcast as a space to allow myself and my colleagues to share resources and bridge the way we do systemic therapy with the way we teach systemic therapy in our classrooms. Today, I have an exciting discussion lined up for you. Our discussion features questions I sourced from a PhD in MFT student and an experienced MFT professor who's navigated academia for a few years now, and she's here to share her insights. Here with us today, we have Dr. Jackie Williams-Reade, LMFT. Jackie is a professor at Loma Linda University, and she has taught both master's and doctoral level MFTs and counseling students since 2012. Over her career, she has taught in a variety of settings, from undergraduate to PhD, and in several formats, including in-person, online, synchronous and asynchronous, and week-long intensives. Her specializations in teaching are medical family therapy, integrating spirituality into therapy, and qualitative research. She has numerous publications and presents regularly on a range of topics, including medical family therapy and clinical supervisory and teaching innovations. She's co-author of the textbook Self of the Therapist in Medical Settings, A Sociocultural and Systemic Perspective, 2019 by Springer. And she's the administrator of the Medical Family Therapy group on Facebook. Dr. Williams-Reade recently received her institution's Faculty Award for Scholar Researcher Excellence in 2024. She has been regularly involved in AMFT leadership activities, including being a member of the Elections Council, board member of the California Division, founder of the Family Therapists in Healthcare Interest Network, and on the board of directors. The PhD student we have with us today is Rose Lange. Rose is a licensed clinical professional counselor, LCPC, in the state of Illinois. She holds a master's in marriage and family therapy from Fuller Seminary in California, and she's currently working on her PhD in couple and family therapy at Adler University in Chicago, as well as her certificate in sex therapy. In her clinical work, Rose primarily utilizes contextual therapy with collaborative and emotionally focused interventions with an aim. She's pursuing her PhD to diversify her career with teaching, supervision, and publication opportunities. Rose is especially passionate about teaching, and she's currently a teaching intern at Adler University in sex therapy and couple and family therapy programs. When she's not working, you can find her at home with her husband and 3 house bunnies watching movies, reading books, and crocheting. Welcome both, and Dr. Williams-Reade, congratulations for your award as well.
Oh, thank you. Thank you so much.
Yeah, and welcome, Rose.
Yes, thank you. I'm glad to be here.
In this episode, we'll be exploring some very insightful questions that we pre-sourced from Rose, which will be answered by Dr. Williams-Reade. I'll be facilitating the conversation by sharing these questions, and I'm excited to hear Rose's perspectives and also the lessons learned and wisdom that Dr. Williams-Reade can share with us. So without further ado, let's dive into our first question. Dr. Williams-Reade, tell us about what was your process of conceptualizing your teacher identity? And Rose was interested in hearing more about the journey or the story around that.
Yeah, well, thank you for the question, Rose. And I liked the intro, Sophia, talking about the isolation you can feel as early career, because that's what's so hard, isn't that identity, I think, of being a professor is being developed while you're isolated in a new career. And so it's especially challenging to have to figure out how to present yourself as a professor. I very much remember being very excited to be a professor because I had a favorite professor. Well, I had a few favorites, of course, but I had one in my mind that I was really modeling myself after. And she was very warm and kind and supportive, and you could stop by her office and she could listen, and she was brilliant. You know, she was smart. Her classes were amazing. just really the whole package. And I was just like, wow, if I could be anything like her. And so I started with like the wanting to be really available to students and really listen because I know how hard it is to be a PhD student. And I was teaching in the doctoral program. And so I really wanted to be available, really wanted to be there for students. So that was going to be my identity. You know, I had a plan for my identity. And it was going to be supportive of students, able to be there for them emotionally, kind of whole person kind of care in a way, and be a great teacher. And both were a lot more challenging than I anticipated. And so my idealized self um, came about. It's like, or what I idealized versus what I became is different. What I wanted to be was much more warm and supportive to students, much more, my doors always open, come on in. And when I started to operate that way, I think a lot of students really liked it, loved it. I mean, I was making great relationships with students, I was there for students. It felt good in a way, and it also was really exhausting. And I was not able to get my research done. And I had a pretty hefty, quota for research to get promoted. And so I was really struggling to do it all well. Felt like I was becoming resentful of students and then taking my time, but I was like pushing because my plan, my identity was to be available. And then that availability was crushing me. And so I really had to, over time, just adjust to the idea of like, I can't quite be who I want to be. I can't quite be as available as I want to be. I can't be that professor. I'm just too much of an introvert. I'm whatever, all the factors. I was like, it doesn't work for me. And so I did have to start limiting my availability, limiting the conversations I was having with students, really kind of stopping them before they went too far personally, kind of trying to stay on track, asking them questions. I think I still have connections with students and alums, but I just had to adjust my expectations of how far I could go, how much of that personality I could kind of bring to my professor role. And so that was an identity shift sort of thing that I had planned versus what I had hoped what I hoped to be versus what I could be. So there was a lot of identity shift there. And then I think I thought students were just like me and they would respect their professor, be kind to the professor, listen, engage. If there was a problem, they would talk to the professor. I just assumed that students were like me. I just didn't know any different. And then I had just a few experiences. There really aren't many, but they were so forming in those first 3 or 4 years. It was like a fire I went through. There were probably in those first 4 years, there were probably 3 students, maybe 4, that were so challenging. They would challenge me in class. They would critique my syllabus. They would critique my teaching. They would every day kind of comment on the textbook that they didn't like and why would I choose that textbook. They would defiantly call me Jackie when I asked to be called Dr. Williams-Reade. It was difficult. There were some that were just very difficult. And when I would sit down with them, assuming that I could work it out, I had therapist skills. I mean, I've got skills to do this. I can handle conflict. I would try to work it out. And I even felt like after those conversations, I kind of like almost cowered to them. Like I softened because they were so upset, even talking with them. And I was just trying to say, like, what's going on? Like something's happening. I want to figure this out so we can like, I want you to learn. I want it to be a pleasant experience. And I felt like in the end, I ultimately had to give in because I could tell they were so upset and getting more upset. And so I was very confused. And then some of them went to the vice president to complain about me, to the dean. They threatened legal action over things that were not those kinds of things. You know what I mean? So it felt like it was exploding. And I was like, I don't know what I'm doing wrong, but it's really terrifying to feel like you can't even trust yourself because you feel like you're in these conversations. You feel like you're doing a good job asking how they're doing, trying to ask them a lot of questions, keep the power dynamic level. You don't want to come on too strong. You know the power dynamic. You don't want to engage in it that way. Doing your best and still just getting like kind of, I don't know. I didn't really get in trouble because nothing ever came of a lot of that stuff, but just feeling like I was doing it wrong. And I would come home and my husband is also a professor and I was so like had no identity at that point. I was just so afraid of my abilities that I didn't have enough. I didn't have good ones clearly from the results I was getting with a few of these students. I would come home and I would be desperate for him to give me advice. I'd be like, okay, the student wants an extension. Should I give an extension? This student wants this student wants that. Like, what should I do? What should I do? And I would do what he said because I trusted him. He was a good teacher. He got great reviews. He didn't have problems. And so I was just like, okay, if I just do it like him, I'll figure it out. And it just didn't quite work. I mean, some things worked. He taught me a lot, and I did a lot of things better. He was much more boundaried, like kind of in some ways more consistent, or just had good ideas, right? Like he'd done it for a while, had some good ideas. And I would apply some of those, and some of them would work, and some of them wouldn't. But I was just so stressed, and our marriage was stressed with all my anxiety. And we ultimately went to couples therapy. I did my own individual therapy, became a little more differentiated, and then was able to kind of adjust and have boundaries with those challenging students and deal with those kind of attacks or like insults or whatever from those difficult students and be able to maintain my own identity outside of what the students thought of me. Of course, I listen to students. If students have a problem with the class, a problem with this, I'm going to listen and adjust. I'm talking about those challenging ones that are, that are tricky, that are not treating you well, that are disrespectful. Those are the ones that really, I think, put me through the fire of forming my identity and the boundaries I would have and how really I would respond to challenging students too.
Rose, did you have any thoughts? Yeah, Dr. Williams-Reade gave you
Yeah,
lots to think about here.
yeah. No, it's helpful. It's a lot of what you're saying sounds to me like in my program, in my PhD program, we talk a lot about self of the therapist. We kind of use the self of the therapist model to develop our own kind of therapist identity and supervisor identity. And a lot of what you're saying sounds like your own almost like self of the professor journey. And I think one thing I was curious about from what you were saying was um, just kind of how, if there was any ways that you like interacted with your colleagues around any of that, or was able to seek support or help from your colleagues or from the MFT teaching community?
Yeah, so this has been, I've been there 12 years and our colleagues are almost fully turned over. So if I talk about colleagues, I'm not necessarily talking about the ones I'm currently working with. I think we had a bit of a culture at that time. I'm not sure really what the culture was, but I would ask for help, and often I would get the response, "Oh, well, that student's great in my class. Oh, I don't have a problem with that student. That student's one of my best students." And so, as a new professor, I'm also not going to push it and be like, "Well, excuse me, I actually am having trouble, so can we talk about it?" I was like, "Oh," immediately like, "Oh, it's me." And so you get that comment enough that people are kind of like, "Oh, I think that's a great student." That you basically are like, "Well, I'm no longer going to share because that's scary because you're going to think I'm the problem. And I think maybe I am the problem." And so I didn't get a lot of support in that way at the beginning of my career, but it's really made me then more attuned to those new faculty that are coming in. I always try to meet with them. I've mentored some of them, try to be available for those teaching moments that I can teach them how to teach or just share my story in case it helps. I'd love to tell people like I had a hard time. A lot of students didn't respect me. It was really terrible. Like, don't be worried about yourself if it goes poorly. Um, that doesn't mean you're in the wrong spot. So I definitely want to send that message because just in case, because I definitely was really worried that I was not going to ever be a good professor with how it started. But definitely colleagues in the field, like fellow students or people on the same track, right? It was those new professors that really gave me the support that I would reach out to. And some of them would give tips, just like, well, I don't do this, or this is my policy, or this is what I would do. So definitely learning along the way from other professors and even outside the MFT community, just professors in general, learning how to be a professor.
Yeah. Looking at a lot of syllabi. What is everyone's policies? I
Yes.
find that I did that a lot in the beginning. I started following, I think it's one of the divisions of APA, the division for the teaching of psychology, STP. They had a large Facebook group that now it has a format that it's just for announcements, but it used to be a very kind of active group of educators that were anything that they were baffled about, they would post and ask for help. And so you would get a lot of different approaches in the posts about different issues, whether it was a student issue, a grading issue, an assignment issue. And that kind of served as the inspiration for a lot of the conversations I start these days within SCMFT. But yeah, I'm only 3 years into a full-time teaching position, so I am kind of in that process also figuring my identity, although some things are becoming more clear inside me. I definitely have a lot to figure out. And I also haven't had these like super challenging students, maybe one or two that, had to be terminated from internship sites or had to be canceled out of the program or something like that. But nobody who like openly challenged me. So that sounds like a really kind of moment where you're questioning, like, am I doing the right thing here? Should I be more strict? Can I be more strict without kind of turning my students away or turning them off? And finding that balance within yourself, like what is my absolutely non-negotiable, the behavior that I won't tolerate from a student, and what is negotiable within the space. Like, can I have any empathy or understanding about the behavior or the request or the challenging or the questioning or the critique, right?
Exactly.
Yeah. I'm going to move us to the next question by Rose. And this one is about teaching in online programs. And Dr. Williams-Reade, you've been teaching mostly asynchronously in the last few years, but you've also taught a live synchronous formats in online classes. So
yes.
Rose mentioned before our meeting, a common talking point is that online programs do not produce as rigorous training as in-person MFT programs. What are your thoughts on that? And what can we as educators do in our online classes to make sure our students are well trained?
Yeah. I mean, I just don't think that's true, because so much of teaching quality is about the professor and the readings and the students doing the work. And I think what can happen is that students can have the expectation when classes are online that they'll be easier. And so you can assign all the same things that you do in an in-person class. But that expectation that it's going to be easier is just sort of there. And so then they won't always give themselves enough time to actually put in the time to do all the reading and do all of the assignments. So I think for most of our, I think the MFT programs or whatever, I would say that's the online programs. They're not necessarily going to be lower quality, although of course we all hear of those institutions that are kind of like the diploma mills, right? So it's not like they're never lower quality, but you also get in-person programs that are low quality, So I think you can kind of villainize online programs, and of course there are examples of lower quality education in online programs, but it doesn't mean just because they're online that they're lower quality. It might take a little extra work, though, I think, to keep them at even the same quality. Because when I've watched my own courses go from in person to online, you can see that students, like, it kind of slips away from you a little bit because I think they do think it's easier. They don't give the same amount of time. When they're on the screen, somehow on the screen, synchronous, there's just not as much pressure to participate. Like in a class, an in-person class, I can wait 10 seconds. That was one of the rules I instituted. I'll ask a question, I'll count to 10. And always someone will respond. Within 10 seconds, someone's going to feel the pressure and they're going to talk and you go on. Asynchronous or synchronous, I have sat there looking at a screen of students and counted to 10 seconds, not a peep. Counted to 20 seconds, not a peep. Like, it's just so different. They just don't feel the same pressure. And so the dynamics can be, yes, definitely a lot more challenging. For me, what I've experienced teaching synchronously. Synchronously is actually my least favorite way of teaching. I prefer in-person first, then asynchronous, and then synchronous, because it is that pressure of the participation is just so hard. And I find I have to overcompensate and be extremely like animated and engaging. And to do that for 3 hours, it's just a lot more work than the other formats, I'd say.
I'm imagining students not being on camera when you had to count to 20, or were they on camera?
Nope, on
They
camera.
were on camera? Oh, wow.
Yeah.
Okay.
Yeah.
Yeah, that is quite a challenge for engagement for sure. Rose, what were your thoughts?
Oh, I just in my internship, in my teaching internship right now, it's virtual synchronous classes. And the core professor and I are dealing with some similar issues where I think it seems that students, if the class is virtual and therefore they're probably tuning in from home, or tuning in, they don't have to like come to the campus and sit in a classroom. um, some of those lines between like home life and class life blur a little bit. Like we've had students like tell us like, oh, I might be in and out a little bit because, I'm moving today, so my movers are here. Or another student was at one point was like, oh, I'm actually at my practicum site, like I'm working the front desk today, so there shouldn't be any problems, but if I have to step away, I'll turn off my camera. And it was something that we had to address with them and had to kind of talk about. Like, I know that there's a lot more freedom and flexibility when you're on video, but it is still a class. Like from this time to this time, you can't be doing something else. And I think that gets blurred sometimes.
Yeah. And I know for us, we instituted that basically like cameras on in class, and you have to be sitting, there, and you can take a break, but you have to text the professor. And then we've kind of incorporated some policies as a department to try to minimize that, because we were having a lot of that same issue. I mean, I can feel it. I'm the same way, right? When a webinar is online, I'm like, oh, I'll go out, I'll do X, Y, and Z while I'm on the webinar. So, I mean, I get it. We're all prone to it. It's just that it's just a new dynamic you have to fight in online programs, is like how to get them to focus and stay on, stay present for the class, because it's just so tempting to be able to do two things at once with all the online options.
Yeah. I also I love if I have a long class on Zoom and it's live, there's no way I'm gonna be like lecturing or having a discussion with them for 3 hours. There's always some kind of activity. There's a series of Google Slides, maybe that they're working in groups, and they're processing maybe a particular topic or applying a particular topic with clients. Maybe a self-reflection exercise that they again process in small groups, and then we come together and we talk. But I can also see that they're actually working, they're writing stuff in the Google Slides. Yeah, there is no way I would go through a whole 3 hour class with just like looking at squares for 3 hours. But yeah, I'm also a big fan of making expectations around professionalism very explicit. I find that some of that went on the wayside during the pandemic. And then starting to teach after the pandemic, I had students, unloading their dishwasher during class and things like that. And I was like, we don't do that. Like maybe that was okay because we were going through a lot last year, but not right now. So making those expectations really explicit and kind of enforcing them. I had to play Zoom police for a little while, and then the students kind of got it. Like, this is how we do
Once you
it.
set the expectation, and you're consistent with the expectation, often they'll mostly rise to it.
They're mostly rise to it. So yeah, I don't know if that helps, Rose, but hopefully gives you some some
Yeah, I
ideas to
thought
go
of
for.
kind of a follow-up question, actually, if that would be okay. Just as you were talking about professionalism, and that's something that for me, I think in my identity, kind of in all of my professional identities, right? Identity as a therapist, identity as a professor, as a teacher, as a supervisor. For me, I continue to think about and kind of wrestle with like, okay, what's the line between like professionalism, which I do think is important and I see as important, upholding professionalism, but making sure that I really see like a link between like professionalism and a lot of like social constructs that I don't like and that I really want to fight, kind of, the white supremacist, capitalist, patriarchal mechanism. And so for me, sometimes it feels a little hard of like to gauge like, okay, professionalism, but not like not doing things just for the sake of doing things. Like I guess it tends to come up a lot maybe in dress or like tattoos or the way people wear their hair, wear jewelry, different things like that. But it comes up in more than dress. But I think my question is, what are both of your thoughts on helping your students maintain professionalism, you yourself maintaining professionalism while also challenging some of these other societal structures that are often linked to professionalism?
Dr. Williams-Reade, you wanted to go first, or?
Oh, Sure. I'll just say, yes, I definitely feel that. And we have a lot of minoritized populations in our programs, and I'm definitely aware of my privilege and think about those things too, of like, why, what am I expecting and why am I expecting that? And why am I offended by this way of being? And should I rethink that? So always trying to be on top of that and learn more and challenge myself. And if anything, I'll mostly have a conversation about like trying to acknowledge that it is, a white patriarchal capitalist society, and so some of these are values of that society. And so then my encouragement is to help them adjust to those expectations. And of course, they can do things their own way, and in different ways they can make their own path, but there will be a lot of pressure to look a certain way and talk a certain way. I mean, it's the whole thing with academic writing. Sometimes I'm like, academic writing, in being in a doctoral program, it's just, yeah, it reeks of all of those structures. And it's like, it's just complicated, but some of the stuff I just still have to adhere to. And so I'll talk with them about the problems with it, but I also still have to adhere to it, or at least I'm not the one who's like actively pushing against it. Like in our program, I kind of more have an overt conversation, but then try to teach them how to meet those standards, but talk about the problem with the standards.
I am so glad you brought up this question, Rose, because I think defining professionalism is very important. So, for example, when I talk about rules around like Zoom meetings and Zoom etiquette with my students, I explain why I'm asking for certain things. So, explaining a rational and also how I feel about coming to class. Like, this is a sacred learning space for me. I really value this time we have together. And so I expect you to also value and appreciate that. I also talk to them about the tuition money they pay for their classes. And so you need to be getting value out of your classes. If you don't, then I'm sitting here wasting my time, and you're also wasting your time and money. So explaining the rationale for certain things, and then also offering flexibility. I think one of the premises, I guess, of white supremacy for me is that sense of perfectionism and urgency, and the worship of the written word, of course. So if there's a way, for example, I don't know, if I have a student that has to miss like a really important class, for example, I might give them like a couple of podcasts, a couple of articles that they can either read or listen or both, depending on how they learn best, and ask them to reflect on this, either by recording something for me to listen to, or in writing. I like to offer when I can, and I can right now because I'm in a pretty small in-person program with those students. I offer as much grace as I can, especially when they come to me and talk about different things that are going on for them during the semester. It's not so much about, oh, you must submit by the deadline. It's, can you get this done and learn something in the process? So that's kind of the motivation. What is the driver behind me asking for certain things? That's something I try to make explicit with my students, and then give a lot of grace as much as I can. And sometimes when you're running large programs, large online programs, there's so much flexibility you can give before you have to give an incomplete for a class, or the student cannot progress in the program until they pass the particular class, right? So it's all about having a discussion with the student about the work that needs to be done and why it's important that they complete certain work before they can progress. As far as makeup and hair goes, although I'm a white presenting female, I have wavy hair. And so even in my master's program, I remember feeling like I was looking unkempt unless my hair was completely straight. And I don't know how I got that idea around me, but I just remember seeing all the women around me like super straight hair in the clinic, right? In the university clinic. And I was like, oh, is my hair professional? Like, do I look like I just rolled out of bed right now? So I had a lot of thoughts and doubts around the way I looked and the way I presented. Then I came to find out my colleagues of color have even worse experiences than this, where they get discriminated or called unprofessional for wearing something that feels culturally appropriate and affirming for them, or having their hair styled in a particular way, or wearing their natural hair. So there's a lot of discrimination to be dismantled here in our clinical therapy rooms and clinical settings and in our classrooms. I'm going to move us on to the next question here. This one is about looking for faculty positions. What tips and resources do you have, Dr. Williams-Reade, for finding online programs that are hiring either for faculty positions or adjuncts? Any ideas?
Mhm. Well, onlines are the full-time positions. I think I don't know if they're easier to find, but it seems like there's the website. I'm not as much into that as I am in the adjunct, or have ideas about the adjuncts, but well, even like your Facebook group, Sophia was like, has now that's a place where people are offering the job descriptions, because sometimes they are impossible to find. You can only find like 4 on like Indeed or hire or jobs or whatever, but then there's so many more. And so I don't know a good resource for that. We kind of tend to get them as program directors. Often we'll get requests or announcements as program directors. I'm not a program director, but I know our program directors get them. And sometimes we do as faculty. And so we'll forward them on to our alums and to our current students. But I think it is probably kind of tricky to find them. Sophia, you might have better ideas for those jobs where they are.
Yeah, I think starting as an adjunct sometimes, not always, but sometimes can give you kind of a way in, putting your foot in the door, right? And it never guarantees that you would have a better chance of getting a full-time position in that program. But the thing is, you never know who is going to retire, who is going to move to a different state, who is going to, leave their full-time position for whatever reason. So these days I see a lot more adjunct positions out there, more than ever, I think, in our field and others. So it seems like universities are relying more and more on sessional adjunct faculty, instead of offering full-time positions with benefits, with all the things that come with a full-time position, maybe tenure track opportunities. So I think connecting with colleagues, even if that means sending out an email to a colleague that you met in a conference and you had a common interest with, right? Connecting with colleagues so they keep you in mind. I think a lot of our hiring processes are merit-based. Of course, you have to go through an interview process and everything, but it's also about fit with a particular faculty group in a program. And so that counts for something when you have already established a connection, or people know your work. Maybe they have collaborated with you and they can speak to your work ethic or your consistency or your reliability as a person. That goes a long way, I think. Yeah.
I was going to say, I think regarding the adjunct jobs, I think people assume, or I remember feeling this way, that it's like they're an official job. And so they have a job posting. So you're looking for adjunct job postings. And once you're like in academia, you kind of realize like a lot of places never will post an adjunct job description. They're just like, oh, it's 3 weeks before the quarter started. We just lost an adjunct. We need a new adjunct. Who do we know? And so in some ways, it's really keeping in front of your own program directors, or your faculty that you're maybe from, depending on what area you're in, or if you live somewhere else where your program wasn't. Even asking your program director if they know people in your area, like the faculty that are in your area, emailing those faculty, emailing the program directors. Sometimes the chairs make those decisions, the hiring decisions. And so you can email the chair and just you could give them a resume, but I would recommend like an email that's pretty concise, but says, I'm available for adjuncting, and say what ways or days, if there's days you're available or not, or online, some of your basic experiences, and then also some of the main areas maybe you've taught before or your main interest in teaching. Try to look at their program to figure out which classes they have. They're all a lot the same, because if they're an accredited program, they have a lot of the same kind of course content requirements. But look through those and give a few that you would like to teach, and keep doing it, because just doing it once isn't really enough. And then if that program is offering anything to the community, like supervising training, CEUs, open house, try to go and get to know people, because those relationships will keep you in the top of their mind. I just find it's like just not as of a technical, like procedural thing as people think it is. It's really like, oh my gosh, we need somebody. Who do we know? Who do we know? So to stay in their minds is probably one of the best ways to get those adjunct jobs. And then, yeah, like Sophia is saying, it's like that can lead into the full-time jobs. And then for other online programs too, it's even if you're not in that area, but you want to teach online, emailing those program directors and those chairs and saying you're interested. Sometimes those big online schools, though, will have that job description out there and you apply to that specific job description, but it never hurts to email the program director, email the chair of the department, and put yourself in front of them that way.
Yeah. Yeah, that was I don't know, hopefully that was helpful.
Yeah, that's
Rose.
great advice.
Yeah.
Thank you. Yeah.
Awesome. I'm gonna move us next to discussing gender dynamics in teaching. One of your questions, Rose, was about the role that gender plays in your teaching identity and your philosophy of teaching. And do you want to speak for a moment about your gender identity and maybe the reasoning or the motivation behind asking about that?
Sure. Yeah. So, I am I identify as a gender fluid woman. So I use she, they pronouns, and I have a lot of like I'm cisgender passing. I have that cisgender passing privilege. And so I just have heard, I've had my own experiences, and I've also heard stories from my women peers in professional roles who have felt disrespected by students, but by primarily it'll happen over and over by male students. And I was just wondering kind of if that's been your experience and how you navigate this, and really, so kind of that specific question, but also just the broader question of like, how does gender show up in your work?
Such a good question. Um, I would say for me, and this is going to be so personal. All this stuff is so personal. Like anything you experience, it does it. It's all about all your identities, how you're presenting, what student population you have, what the the culture is in your department. Like so many, and what students can get away with, what they can't get away with. So there's just a lot of factors in all of this. So one, it's not just about you. There are so many factors going on with these student professor dynamics, and everyone's story is different. Just to acknowledge that. Um, I have found we're a primarily female population for students, right? The MFT programs for us are usually like our master's, especially, is often all females, but there will be some males for sure in there, but there's usually just a small handful. I teach a little bit in the master's program. And then in the doctoral program, we do get more males. That's kind of a bummer, right? A lot of doctoral faculty or even faculty are males, but then a lot of the students are primarily female. So you already have this like gendered thing happening in terms of who gets the faculty jobs. But I would say male students have not been, I mean, they're an issue. I've had issues with some male students, but overall, it's not like I look at and think when a male student's in the class, I'm like, oh boy, here we go. I definitely don't, I've had much more problems from the female students. And even what's interesting is I find I have more problems with female students who actually are aware of sociocultural issues. They're interested in social justice. They think about those things, they'll talk about those things, but I think sometimes they miss the gender piece. Or forget about it or don't realize they're participating in it. So disrespect is one thing. This is part of disrespect. It's not as huge, but I've definitely noticed that I'll introduce, let me say, our culture at Loma Linda University when I got there, it was very much doctor, your doctor so-and-so, doctor last name. That's how people were introduced. That's how the faculty were. All of my training, my master's program, my PhD program, all the faculty went by their first names. So I was totally up for going by my first name. And then I got to Loma Linda and it was like, oh, people are being called doctor. And at first I was like, well, I'm not going to do that. Like, I'm going to go by Jackie. I want to be more, available. I want to be more like equals. And then I started to get some disrespect and I was like, well, maybe I will go by doctor. So I started to ask to be called doctor. And it really, you don't have to ask because it's sort of in the culture. But what I found and over the years, people will kind of trend and this is males or females, will trend to starting to call me Jackie. And part of me was fine with it, but then every once in a while I'd get an email from a student that was to me and to a male faculty member, and it'd be like, "Hi, Jackie," and Dr. So and so, and I was like, "Wait, we have the same." Or from the administrative assistants would, if there'd be multiple ones of us on an email, it'd be like, doctors so and so, and then all female faculty first names, and it's just mind-boggling, and makes me so angry. And so I started to sort of demand the doctor thing. And that definitely gets different reviews in class. You can tell different responses. You can tell I'm kind of can, make some people uncomfortable. They kind of think I maybe have an air about myself. So when I used to just do it, I would just kind of like ask them to call me that. Now in class, I'll definitely explain what I'm doing, and I'll say why I'm doing it. And it's because I'll say, like, I'm happy to go by Jackie as soon as you call every single faculty member by their first name. Because I'll ask students, I'll be like, to try to alert them to what they're doing, because I don't think they mean it. Some of them have meant it intentionally, but very few and far between. Mostly they just don't it doesn't occur to them. They kind of feel, I think, connected. I'm a woman. That gendered aspect is I'm supposed to be warm and supportive and available and more on their level. So they want to call me Jackie. And then I will bring that up and I'll say, "Well, what do you call your male faculty?" And they'll say, "Oh, definitely doctor, always doctor." I'm like, "Okay, what makes you want to call me Jackie?" And it's usually always very kind, right? Like, "Well, because we've talked and you know more about me than they do and all that." And I'm like, "That's great. But here's what we're going to do. I want you to call me Dr. Williams-Reade. And because when you graduate, I want you to be called Dr. So-and-so. And if people start calling you by first name, I want you to correct them and let me be the person who shows you can do it and you can correct people." And it's kind of a small thing, but it's also kind of a big thing. And I have had alums come back and say, "When you told us to call you doctor, we really it kind of, put our noses out of joint a little bit. We were sort of like, wow, look at her thinking she needs to be called doctor." And they're like, "Even though you explained it, we still were kind of like, okay." And then they're like, "We're so glad you did," because now I'm realizing all these students are calling me by my first name and I'm correcting them. And I really just, like, in an email, I'll just respond and say, "I go by Dr. Williams-Reade. I go by, I just do it calmly now. It doesn't really have a lot of energy to it anymore because I've done it so many times." But again, I've noticed, students will talk about the other female faculty as they're so warm, supportive, they're always available. And then the men will get called brilliant. "Oh, Dr. So-and-so, he's so brilliant. He is so amazing. He's just so busy. He can't, get back to me very quickly because he's so busy with his research and it was really important." And I'm like, "I'm doing research. I have some importance. I'm getting back to you. Like, come on." And so it's just kind of everywhere. It's everywhere all the time, whether it's in like significant disrespect or just like benign interactions. So it can be definitely really tiring. I think now I've just dealt with it so much. I'm like, "Oh, there it is again." And so it doesn't have the same energy to me, but definitely when there is a gender dynamic with a student, it can feel a little, I don't know, it can feel a little scary. I think a little scarier in a way sometimes, just because men are believed more, are respected more. So your administration might, lean that way. You just don't know. So it is risky. I do try to remember when they're coming at me. Like, I was giving this one student, male student, feedback on his dissertation. I have a PhD. I've had it for many years. I'm a specialist in some areas. I was giving him some a correction. He had said something incorrect, and he was just sort of like, "Well, thanks for the feedback, but I kind of think I'm gonna do it this way." And I was like, "Yeah. Well, I'm not just giving you feedback. I'm actually telling you how you need to change the paper to make it correct." Like I'm just like, come on, like, but yeah, they'll just sort of dismiss you sometimes. But yeah, so it's always there, and I try to remember they're stuck too. They're stuck in patriarchy. They think they have to be smarter than me. They think they have to know everything. They think they have to come in tough and not needing to learn and stand their ground. And that's patriarchy too. And they're stuck in it. And so I try to think of it like that too, of like, you're a victim of it too, even though it's looking like you're the oppressor and you're the one in power, but you're stuck needing to be the oppressor and the one in power all the time. And so that can help me kind of like rethink it or have some compassion and not get so like activated or reactive around it. But it's tricky. It's hard.
Yeah. And it's not always easy to react to the microaggression, whatever is going on, and either reverse it or make it explicit that what you're saying right now indicates to me that you're not really believing have credibility as a professor, or that I am a legitimate researcher myself. These are such great examples to illuminate the gender dynamics. Rose, is this kind of what you were looking for asking this question?
Yeah, it definitely is. Yeah, because I think Dr. Williams-Haas, you're really speaking, sorry, Dr. Williams-Reade.
Yeah, it's a
Yes.
mouthful, I understand.
Melina
Yeah.
Williams-Haas is a different
Oh,
person that
oh.
I love. But Dr. Williams-Reade, you're speaking to kind of the insidiousness of those mechanisms, the insidiousness of patriarchy, where, you know, these aggressions and microaggressions are happening and people don't even realize it, or they think, you know, they're coming from a good place. Or, you know, trying to come from a good place. I see that a lot in like kind of health when we get into kind of healthism and fat phobia and things like that. Weight stigma, microaggressions that can happen when and people just think they're coming from a good place. So yeah, I think that's a really important point that, you know, it's okay to kind of recognize that and to still say something and to still, you know, call attention to it, bring it from the insidious, the covert, bring it into the overt and shed light on it.
Yeah. Dr. Su's research on microinterventions and microaggressions is great. Although his was at some point, I think mostly focused on racial microaggressions. I think a lot of the microinterventions he discusses are actually applicable in gender-related microaggressions. Jackie, did you have any other resources around addressing microaggressions that you wanted to share?
I think the one thing I would say is like I think what I wasn't aware of necessarily is that you do have to protect yourself as a professor, protect your reputation, and that some of these, like of my difficult students, there are males in there, and so they probably represent a higher ratio of how many males there really are in all the students, right? So they are kind of more of a problem, even though there's not that many of them, but that there's two of them and there's three of females that I think of when I think of these stories. Obviously, they're taking up about 50%, and they're not 50% of our, patient load, student load. But I would say I think you need to protect yourself, especially from some of these challenging students, because I've definitely tried to not take into account, like assume the best, think that they can be rational and respond to me. And whether it's gender dynamics, other things that are really turning them against me, sometimes those are not, I'm not able to get through, even if I'm definitely trying to ask a lot of questions and understand and do small things, like I can just be misinterpreted. And I have had issues where I'm trying to talk with them one-on-one and figure it out, and then they go around to administration and really report the conversation in a way that is not the way it happened. And so I will, if I'm having trouble, I will talk to an administrator almost right away, talk to a chair, usually even skip the program director, just go right to the chair. And if it's like something seems significant, because I want to be the one giving the information. Because I think part of gender dynamics or some of these dynamics is it's power. And sometimes if you tell the story first, then that story has to be refuted, rather than if the student tells the story first, then you're the one refuting. So, and that's privilege, I guess, to be able to say the story first. But I've just found to protect myself from these difficult students, I try to get to administrators, and I have someone in the conversation with me now. I don't do one-on-ones with the ones that are really troubling me. I get an administrator in that room or program director to have a conversation, because I need to be protected, because my words will get twisted. So you do have to protect yourself, which is unfortunate, but
Yeah.
it is reality.
Gold. This advice is gold, I think.
Yeah,
Rose.
that's good to know.
Thank
And
you.
I appreciate having the advice before I have to learn it the hard way. Like that feels really helpful.
Yeah, 100%. This is exactly the reason why I'm having this podcast. And so there you have it.
Let my
I
pain
want
be a teacher. Let my pain be a teacher. Yes.
Yeah. So I want to say a big thank you to our fantastic guests, Dr. Jackie Williams-Reade and Rose Lange, for sharing their experiences and insights with us. I hope their wisdom and experiences will help fellow educators and listeners in their own academic career journeys. To our listeners, we hope you found today's discussion enlightening and inspiring. Be sure to follow our Learning and Teaching Systemic Therapy podcast episodes on Spotify, YouTube, and Apple Podcasts. We have exciting episodes coming up every month, so stay tuned. Here at STMFT, we believe in the power of mentorship and the importance of representation in education. If you're interested in becoming a part of our mission or you seek guidance for your educational career journey, please visit our website at stmft.coastmft.org and consider joining our Facebook group, www.facebook.com/groups/stmft. Thank you for joining us today. And until next time, keep connecting and learning with colleagues. This is Dr. Sofia Georgiadou signing off for STMFT's Learning and Teaching Systemic Therapy.